Hello and welcome back to Health Unlock, the power of salutogenesis. Today is a special day because after a long run, we have made a decision to switch our focus towards decentralized healing. And we are launching a new season along with this today. So season 2 and episode 1 for season 2, we are going live today with that. Jason, how are you feeling about that?
Pretty good. Yeah, I guess the first season was surprising from my point of view, I suppose. I didn't think that so many people would be interested in what I have to say.
Yeah. I mean, I'm sure a lot of people are interested in what you say. It's just like this is the first time we got in front of the people. So there was a little bit of resonance there. And we want to now take it to the more direction of we've talked about a lot of things in season 1. Now it's the question of how do we get actually all those things in people's hands? And that's why this was the trigger point for you to tell me, like, you know what, I want to just make sure we kind of pivot and move towards this very focused idea of we talk about decentralized healing and everything that's involved in this so that more people can actually get what we are talking about in their hands, in their houses, in their healing process. So here we are.
And I
Let's
guess
start.
this is probably going to be, so this first episode is probably going to be some recap of what's happened before, maybe reframing it a little bit.
Yeah. And this is to catch up with people and build the rhythm here. So we're going to talk about the chronic disease crisis today and why a lot of why involved today, why everything we try makes it worse and what actually, and then also hopefully talk a little bit what actually works. So let's talk with that. Can you paint a picture of what the chronic disease crisis actually looks like for families and the healthcare system?
Sure. So if we just look kind of in the US, I think it's like 6 in 10 adult Americans have at least one chronic disease, and I think it's like 4 in 10 have 2 or more. And those numbers kind of they represent a healthcare system that's fundamentally broken, and families that are being destroyed financially and emotionally. I guess well, chronic disease now accounts for something like 90% of the nation's like over $4 trillion in annual healthcare spend. That's a lot of money. And it is also the leading cause of death and disability in the United States. And it's not just affecting elderly anymore. You're seeing younger and younger people and younger populations get diagnosed with conditions that used to not show up for decades. Children or even developing chronic disease at rates that no one's ever seen before. And the financial devastation from all of that is real. Medical bankruptcies are, I think, the leading cause of personal bankruptcy in the US. Families are making these impossible choices between treatment and, I guess, basic needs like, their food and housing. But the money's really kind of only a part of it. The quality of life destruction, the pain and disability. I guess there's also an inability to work, which then goes back to financial stability. But it's really, this is kind of the loss of the participation of life itself. And that's kind of, I think, what really breaks people. And as you know, I know this sort of personally. Between 2013 and 16, both of my parents, my sister, and a good friend's mom, whom I consider family, all got cancer. And there's a lot of fear and confusion. You're willing to kind of try just about anything. The money that we wasted on worthless treatments, both conventional and alternative, was well into 6 figures. And it seemed like more often than not, all of this kind of spirals into hopelessness and despair because, everyone besides my sister there ended up dying anyways. And it really was that catalyst that experience was the catalyst for everything that I'm doing now, both with Eudaimonia, the Human Flourishing Center, and also Ionic Alliance Foundation. I guess, I don't know, when you see people that you love suffer through a system that has nothing real to offer them, it changes you. At least it did me, made me ask those hard questions about why we accept all of this as normal. And meanwhile, the healthcare system is overwhelmed for sure. Doctors get, what is it, like 15 minutes per patient? and they can barely manage symptoms, much less address root causes. So we do have kind of a systemic problem there. And we're stuck in this vicious cycle where treatment costs keep increasing, outcomes don't improve, and more people are getting sicker younger. And the system is really just designed to manage disease, not resolve it. And that design is really kind of bankrupting us while destroying lives.
And you were generous to say 15 minutes. The actual number is 8 minutes.
Is it? Yeah.
Yeah. So you could imagine we are more like a KFC right now in healthcare system rather than a healthcare that will give time to patients. So I know, we spend the most money in the world in this country, and yet chronic diseases rates keeps climbing. What's going on, I guess, systematically, or what in your opinion is the problem here?
Well, so the healthcare system was kind of designed around the acute care model, right? Infections and injuries and emergencies. And for those things, it does work well. If you break your leg or get pneumonia, modern medicine is what you want. But from the perspective of conventional medicine, chronic disease is fundamentally different. They see it as a permanent condition. I mean, it's in the name, not an acute condition or an acute event that you can kind of fix and move on from. And when you have this, I guess when you believe that something is permanent, the only logical approach is then lifelong management of whatever that condition is. And so here's how conventional medicine operates, right? Everyone kind of knows this. You identify a symptom, you prescribe a drug to suppress that symptom, and then you manage it indefinitely. And they don't really look for root causes because they don't believe chronic disease has reversible root causes. Here's a good analogy. Think of a mechanic dealing with an overheating engine. Hopefully this is something that everyone can kind of understand. So where each intervention makes sense kind of given the current observations, right? So the engine runs hot as you add coolant to it. That's cheap. That's the first thing you try. It might even help for a bit, but if it still overheats, you replace the thermostat. I guess it's a little bit more invasive, than just adding coolant, I suppose, but it makes sense because they fail often. Turns out if that doesn't do much, it's already done. So you don't get your money back. So moving on, time to replace the entire water pump. And when that doesn't fix it either, you're looking at replacing the entire radiator now. And then you have to ask, is that even worth it? Maybe it's just better to top off the coolant every time you go fill up the gas, right? And I don't know. I guess we're not really cars. So how's this work in medicine? Take diabetes as an example. Metformin lowers blood sugar, and perhaps someday some brilliant person, maybe AI, will figure out why metformin or the metabolic function was disrupted. But for now, all they know is that it happened, and they see that disruption as permanent. And so the patient takes the metformin long term, and then treatment often kind of escalates from metformin to insulin. Then other complications eventually develop anyways, and you get kind of this whack-a-mole medicine. The patient gets more drugs for more symptoms, and those drugs have side effects that require more drugs, and then the spiral just kind of continues. And I think, like many Americans are on 5 or more prescriptions all at the same time, all starting from one thing. And the economic incentive is completely misaligned here. Healthcare profits from chronic patients. We all know this. It loses money if you cure patients. I don't want to say that, they set out to be cruel, but it creates this perpetual patient, right? And they're profitable kind of right up until all of their money's been extracted. And then they're told, well, maybe it's time to just accept your condition. I don't know. The deeper problem is kind of the worldview here that conventional medicine doesn't understand the root cause of chronic disease, so it justifies symptom management as the only realistic option.
And that's why you also said the word suppresses versus resolves, right? So can you go deeper into that? What's the difference and why does it matter?
Sure. And I guess that distinction really is kind of everything there. So suppression is forcing the body to behave differently without addressing why it's behaving that way in the first place. So some good examples. Take blood pressure medication. They force vessels to dilate, but your body still thinks that those vessels are, or that it needs to constrict those vessels for some reason. And so your body kind of fights back. And then over time, you require higher doses. Eventually, it stops responding as well. And then you add more medication. Resolution is fundamentally different. Resolution means restoring the conditions that allow the natural healing processes to complete. You remove whatever the obstacles are, provide whatever the missing resources are, and you reset halfway. So now the body does the actual thing the intervention just enables it to do. But your body is doing it because it actually wants to do, I mean, it completes the heal, right? So why does that matter? Suppression creates dependency. Resolution creates independence. That's probably the best line, I suppose. And it's, it's kind of like blaming your smoke alarm for the fire, if you will. Your body's doing, the wrong thing. So we have to force it to behave. That's kind of the conventional thought process. Resolution treats the body as stuck. Your body's trying to heal, but can't finish the job for whatever reason. Let's help it complete what it started. And that connects back to salutogenesis from season 1, of the idea that we should be creating health, not just kind of managing disease. And again, and really what we identified there was that most chronic disease isn't really permanent. It's a healing process that got stuck. And let's examine that really quick. I won't go too deep, but look at how conventional medicine handles a chronic wound. Rather than ask what's keeping the wound from healing, they stack 4 interrelated interventions, right? So the first one is antibiotics and antimicrobials, and that's used to eliminate the infection. They generally spark a host of other problems centered on microbiome health, and then kind of send the patient down a whole other spiral of health decline. But those are all lower priority than what's going on right now. So I guess we move on to the second, which is debridement. That's medically removing scabs, even though that actually increases the healing times and the likelihood of scarring. But it's also their only kind of thought on minimizing reinfection of that wound. Then the third thing would be they use tissue growth factors to kind of force the tissue to regrow. Because remember, if the cell isn't, or the cells in the tissue aren't in the correct healing cycle where they want to be replicating, well, they won't do that. But apparently we can force it. But you have to remember, when you force tissue growth, it doesn't always behave. And that often necessitates the fourth intervention, which is those scaffolding products. And they basically kind of corral the forced tissue growth into a better structure to try and minimize scarring or physical dysfunction. That's a lot of stuff. It's also really expensive, but it's also all forced. Force the infection down, force the dead tissue out, force new tissue to grow, and then force it into the shape that we think it needs to be in. Nothing about understanding why the wound got stuck in the first place. Nothing about restoring the conditions that would let it heal naturally. But hey, I guess each step's really expensive. That's suppression, and it creates patients who need perpetual intervention because you never really addressed why they couldn't heal on their own.
And do you think, I've seen there is some functional medicine physicians or practitioners really going for root cause.
Mm-hmm.
And their practice is more towards, let's find the root cause first and then do it in the right way. Do you see this that is more closer to the resolve versus the suppress approach? Trying to give credit to the functional medicine physicians or practitioners who are moving and trying to do root cause medicine, trying to find the root cause and move in that direction. Do you see that more as towards the resolve side of things rather than suppress their approach?
For sure. That's yes. But when you say, okay, we've got to figure out what the root cause is, the problem with that is, remember, as we've discussed before, any cellular threat will send the cells into the cell danger response. And if you do that too often and or repeatedly too close together, then the actual root cause, it almost doesn't matter what it is. And so what I tried to do was, instead of focusing on, oil causes cancer, or I'm trying to think of all the things that California lists off as carcinogens. And it's a whole list. And we've got to get rid of all these things from your life. Well, maybe, and that might help, but in truth, they're just things that trigger a cell danger response. Yeah, that's probably not good to do really often, but what I tried to do was kind of step away from that and look more at the what's happening within the cell. So the cellular root cause, not what the actual trigger necessarily was. Does the distinction there make sense? And so, yes, functional medicine, honestly, I think it's way better than conventional medicine for chronic disease for sure. Because, they are looking at things from a salutogenic point of view. Much of it is focused around nutrition. And, nutrition really just comes down to getting the nutrients that the cells need. Now, there's a little bit more to it. And you can't always fix things just with what you eat. But in many cases, you can fix, or you can either postpone or keep the problems from occurring in the first place with lifestyle interventions, for sure.
So I guess the question is, what is actually happening at the cellular level when someone develops a chronic disease? Can you talk about?
Yeah. So Dr. Navio's cell danger response model explains what's happening at the cellular level. But because everything is kind of interconnected, we need to expand a little bit. So here's where I stepped back from that as well. Microimmune dynamics is attempting to explain what's happening at the terrain level. So the microimmune part refers to the local immune terrain, not the systemic immune terrain. So two completely different things. But everything that's happening in that specific tissue environment. The dynamics part refers to what's actually happening within the terrain, how it interconnects and how it functions. So the cell danger response explains that cells have the natural healing cycles called the cell danger response. They detect a threat, they respond to it, they resolve the issue, they return to normal. That's what's supposed to happen. The CDR also explains that in chronic disease, cells that get stuck partway through that cycle, they're not necessarily broken, they just can't complete the healing process and reset. And they're kind of frozen in that response mode. That's what starts the cascade to chronic disease. And the CDR doesn't really detail why that occurs. And that's what the microimmune dynamics framework was supposed to focus on, why this happens. And in truth, it's actually fairly simple. Cells need nutrients to do anything. And when they're under stress, actively trying to heal, the nutrient demand increases, and it can increase fairly significantly. So when our body's natural, the local reserves or even the systemic supply, that's all usually more than sufficient. But when we trigger that danger response too often, the demand starts to outstrip the supply, and each healing resolution becomes worse than the last, leaving the train with less resilience than before, kind of setting off a vicious cycle of increasing dysfunction. We call that the microimmune fatigue cycle. For example, if a certain terrain has a demand for more zinc than the bloodstream is currently supplying, the local cells can't do everything as well as they should be able to do. And I suppose I should mention that points out that a poor diet could also initiate this vicious cycle, and it can. But so at this point, I would really just call that microimmune exhaustion, where each resolution is worse than the last, but things really aren't completely breaking down yet, right? And many factors can affect the actual systemic nutrient supply, such as diet and nutrition and gut microbiome, all that kind of stuff. And during that microimmune exhaustion phase, as long as those factors are improved, or if they can be improved, then the terrain can start improving, with each healing cycle resolving then better than the last, and then you start to rebuild resilience. The problem is that there are limits as to the nutrient concentrations that the body will allow systemically. And that's especially true for metallic cofactors like the zinc that we were discussing. And once the local demand exceeds what the bloodstream can handle, it becomes tough to ever kind of correct that situation. That's the last stage of the that fatigue cycle, and I call that collapse or microimmune collapse. Somewhere in the latter exhaustion stages, the cells within the terrain have a harder and harder time resolving and exiting the CDR response entirely, and then they start getting stuck. And remember, that's what Dr. Navio identified as chronic disease, persistent CDR states. So then the healing phase, the terrain is stuck in, combined with a bunch of other variables, then determines the specifics of what chronic disease emerges. So that's what I believe is happening at the cellular level with chronic disease.
Yeah, now that it's, based on your explanation, it's clear that cells are getting stuck rather than being permanently broken, which could be a good thing. Does that mean now there's a path to restoring them or fixing them? What's the
Yes.
possibility?
Yeah. So if the cells are just stuck and they're not broken, then we can theoretically unstick them. The key insight there is that we need to restore local terrain conditions. And remember that microimmune collapse occurs when the local demand exceeds what the bloodstream is capable of supplying. So while improving your overall nutrition, or taking supplements might help with earlier terrain fatigue, maybe in the exhaustion phase, it won't do much beyond slowing the decline once you're in collapse, because the systemic supply has a ceiling, remember. And so you need to address the local terrain directly. Essentially, the microimmune dynamics all kind of work together, drive healing resolution. I guess I should say healing resolution competency. That's simply a fancy way of saying that your cells are gaining resilience rather than losing it each time they complete that cycle. Perhaps the most relatable explanation is lifting weights. We all understand that when you lift weights, you stress your muscles, and when you sleep, they recover, and they recover to a little bit better than when you started. But if you lift too much or too often, and you don't give your body enough recovery time, we call it overtraining, and your muscles actually get worse than when you started. Resolution competency of your muscle cells is getting worse and worse. All it is. But muscle cells are highly adaptable, so it's actually really easy to fix that problem. Overtraining is, it's got an easy fix. Slow down and let recovery complete before you start stressing the cycles again. But at its core, chronic disease is really the same thing. You're constantly triggering the healing cycles before the local cells have recovered. The difference is that lifting weights has a pretty tight feedback loop, right? You get sore, you try and lift again too soon and it hurts. And not too many people lift so much that they get to the point where they can't actually move without realizing that maybe they're pushing too hard. Unfortunately, chronic stressors don't have the same feedback loop. And it's pretty common to get well into the microimmune fatigue cycle before you even realize there's a problem. So it all kind of comes down to that local nutrient delivery. And it's the same story as that overheating car. If we go back to it, you swapped parts, ran up the bill, maybe even gave up on the car. And then someone, now a smart mechanic opens the hood and looks at it and says, "Oh, ever think to change the radiator cap?" And if that was the actual root cause, you'd be furious. And that's how a lot of patients feel when they realize that their body might not have been broken after all. It was just undersupplied and overstressed. And theoretically, we can actually fix just about any chronic disease as long as we know where target and have a microimmune nutrient matrix that can satisfy local nutrient demand even when the systemic capacity has been exceeded. And that's the difficult part that no one had ever really thought about attempting, I guess.
And does that mean actually will anything actually restore the local terrain at all or no?
Well, yes. And of course, we've talked about this. Ion biotechnology aqueous ligands, or IBAL, was developed to do just that. It is a microimmune nutrient matrix designed to restore local microimmune function even when systemic supply has hit its ceiling. So here's how it works, right? Turns out the most immediately critical nutrients involved in the microimmune function are the metabolic cofactors of zinc and copper and maybe even magnesium. So IBAL delivers these in an immediately bioavailable form directly to the local tissue. And those cofactors also allow the enzymes in that tissue to function properly again. When the enzymes function correctly, cells can then better control their redox and let's just call that signaling environments. And that proper signaling then supports mitochondrial metabolic flexibility and or mitochondrial phenotypic flexibility, if that's how you say that. Better mitochondrial function then reduces oxidative stress, and all that together enables the resolution pathways that allow improved healing, resolution, competency. Remember, that was just adding resilience rather than detracting from it every time it finishes the healing cycle. So IBAL doesn't force anything. It neither induces nor inhibits cellular action. It's simply the nutrition required for proper immune dynamic or microimmune dynamic. And if I sound overly confident with this, it's because I've personally seen dramatic improvement in lots of chronic conditions, from athlete's foot to eczema, psoriasis, skin cancer, breast cancer. Actually, a retired general was so impressed by the results he saw on prostate cancer that he invited me to present to the deputy director of the VA. He hopes to get that product added to the VA's list of approved complementary therapies for cancer care. And now that we say that, now that the government shutdown's done, I probably need to check back in and find out when we're scheduling that.
Yeah. Wow. I also want to clarify this for our listeners that this is a salutogenic product, which means that it's not going to do the suppression, but also if you don't have it, but you're using it, it's not going to cause side effects. Is that a right statement, first of all?
Yes, that's correct. I mean, the side effects are if you're using it topically, which that's pretty much all it is so far. If you've got broken skin, it stings a little bit. Think of putting hydrogen peroxide on a.
Yeah, because people have fears too. They almost feel like the part that works so well, this might be damaging something else, which is typical in our cryogenic medicine as it happens. So
Absolutely.
that's why I just wanted to put it out here, clearly that it's, even if you suspect you have a wound and you want to try it, at worst, if it doesn't work, let's say if it doesn't work, which it won't happen, it will work, but it won't damage anything or anything else. And that's yours.
So, I mean, if we're talking about the medical product, so it is directly antimicrobial. So let's set that aside. If you have a wound and all your tissue, your body is fully in the early stage of that microimmune fatigue cycle, and you've got sufficient local cofactors everywhere, this actually won't do that much because it doesn't force anything, right? So if your body has enough cofactors, giving it more doesn't make it better. Actually, it makes it a little worse because then it's just got to get rid of all that stuff. Not a big deal. But point is, it doesn't really make it dramatically better unless you actually do have those deficiencies. And then the local tissues do get dramatically better. So it's almost like the worse off the local terrain is, the more IBAL will help it. It's actually not like that. It is that. Whereas if you use it on perfectly healthy tissue, that tissue is just going to expel it. It's going to get a bloodstream, then diffuse throughout the rest of the body and be negligible and not really do a ton because your body already had all the cofactors it needed.
Yeah. That goes back to the image that I tagged you on LinkedIn about that wound, which was there. That's why I was saying like, well, this is it. This is perfect for something like that to heal. And, of course I saw all the discussion those physicians were doing, which is great. I mean, but none of it was to like solve really. It was just to manage it and keep it. Nobody had confidence to say like, this will go away. So that's when I was like, okay, definitely something is missing here, right? And that's when I thought about tagging you on that post specifically. But I guess that's the next question, right? If this works so well, why can't people access it? Why isn't it in clinics like the one that I tagged you on? So,
well, I mean, so IBAL-based cosmetic products are available now. Now, the manufacturer can't make any claims about use for any disease, and doctors might be able to include them in their protocols and treat them essentially the same way that they treat any other nutritional product. They might even be able to use microimmune dynamics to explain what's happening before chronic disease takes hold and how a microimmune nutrient matrix such as IBAL might support terrain restoration and allow the cells to heal naturally. But to really scale to millions of people or the masses, we need to enter the regulated world. And we had an IBAL-based medical device is approved for infection control and wound healing in Mexico and the UAE. But, to facilitate deeper market penetration in Mexico, it's necessary to jump through all, the hoops and get listed in major catalogs of the catalogs of the major distributors and distribution channels, like the public hospitals and pharmacies. And we need to conduct more formal clinical investigations demonstrating the dramatic efficacy improvements and cost savings, which in the medical field is essentially that's their marketing. And doctors really trust what they read in journals. And remember, our strategy, I think we talked about this, was to keep the indication really broad, right? Wound healing and infection control. That kind of means it can be used on anything. And that makes the approval process much simpler. But even though we're seeing it perform better than, anything anyone's ever seen, take diabetic foot ulcers, for example, where it may literally replace the antimicrobials, the debridement, the tissue growth factor, and the scaffolding all in one inexpensive, easy to use topical product. We can't actually market it for diabetic foot ulcers specifically without adding that as a separate indication. Doctors can use it because, that's an infected wound for sure. But we can't market it that way. And most doctors treating diabetic foot ulcers won't even look at, a general healing product because they need something significantly stronger. They assume it's not strong enough for their specialized needs. And the only way to really change that perception is to add specific indications through formal studies and regulatory submissions. So we can heal wounds that stumped everybody else, but we can't market it unless we pretend that we kind of discover all of these things one disease at a time, because, that's science. And so therefore the kind of the product pipeline of additional indications is ridiculous, right? We've got diabetic foot ulcer, venous leg ulcers, pressure ulcers, traumatic wounds, burns, psoriasis, eczema, and so on. Most of those indications have product or specific products that are targeted kind of just to them individually, right? And that really explains how broad IBAL's efficacy is. We can kind of work our way all the way up to adjunctive oncology while still remaining a class 2 medical device. Adjunctive oncology just means, the wounds that issues that occur with cancer treatment. So surgery, you've got surgery wounds that don't close. That's pretty common because you also had chemotherapy or radiation. You've got radiation burns, those types of things. And now beyond that, then we've got different delivery methods that open up entirely new applications, such as, nebulizing it for respiratory infections or allergy relief, fogging it to sterilize occupied spaces where people are within. You don't have to have people leave the room to sterilize the room. You can sterilize it while they're in there because it won't hurt them. Let's see. You can do that. Like ERs and operating rooms would be a great place to do that, right? You've got ophthalmic applications for infections in the eye, like pink eye, injections for tumorous cancers, intravenous delivery for neurological diseases and I guess non-tumorous cancers. So this isn't one product. It's a platform technology where each step could really help millions of people. But all of that takes money, and that's not why it's in clinics yet.
And now this begs the last question that I have for you today is, so how do you fund all that expansion when the conventional system might not support this? It's kind of killing your market.
Yeah. So that's a right question. So run through the funding landscape real quickly from or the conventional or traditional venture capital and such. So conventional venture capital, that's hard to say. I'll just say VCs typically want a pharma acquisition as their exit. And pharma won't acquire things that threaten their chronic disease management revenue. We talked about that economic misalignment before. That's not entirely true anymore with what we're doing here. There is a pathway to convert a medical device to a drug. So we could develop this as a drug, get it then on the market, and then have a pharmaceutical company interested in that particular application, let them, license them that particular application and or product. They can convert that to a drug. And I guess, once something gets classified as a targeted drug, there's stronger protections against competition and such, which is what they want, right? So individual indications might still attract pharma interest down the road. But from the traditional finance route, the most promising would probably be impact investors and family offices, where they care a little bit more about solving problems and than fitting into the pharma acquisition model. And they exist. They're just not the loudest voices around. And so they're tough to hear and find. There are also grants, but before we understood the mechanism, grants were kind of nearly impossible, right? The standard pathway is you develop a theory, you get a grant to validate it, and we had that backwards. We saw the safety and efficacy first, and then we had to really figure out how the heck this is even possible. That's where microimmune dynamics came from, kind of with abductive reasoning. But we developed the ion gel to help people and kind of set the indication as broad as we could, as we talked about, to make it as easy as possible to prove that safety and efficacy, antimicrobial efficacy, you can prove in a petri dish. So you don't even have to do in vivo testing there. For safety, obviously you do. And antioxidation, which is also one of its indications, that's not a disease classification. So that's actually fairly easy to get done as well. So none of those things required disease-specific trials. So it was cheap compared to normal drug development. Now that we understand the mechanism through microimmune dynamics, NIH grants become possible, but we're kind of beyond that early science now. And we need growth funding, not how does this work funding. And I'm sure that we'll pursue grant funding now, but it's also really slow. So what are newer paths? You've got equity crowdfunding. It kind of works like Kickstarter, except that instead of giving away perks that some people never receive, you give away company equity, which you can't not give them. And then you get kind of communities of interested people who actually own a piece of what they're funding. And so the other things with crowdfunding is it sort of validates the products as well, which is a great thing to do. And I guess we've also got sort of the political moment of what's going on now, the whole Make America Healthy Again push. And I guess it's not just a slogan. It is driving some real conversations about healthcare reform and bringing manufacturing, especially important treatment manufacturing, back into the U.S.
Transparencies, everything is getting figured through that. So yeah, there is things happening through that.
Yeah, and then also trying to address root causes instead of always managing symptoms. So this is all happening, and this creates opportunities kind of for aligned capital and government partnerships that weren't previously available. As I mentioned, I've actually been invited to present for the deputy director of the VA, and that's seems crazy. Then there's also decentralized science, or DeSci, and I find this really, really interesting, and it's something that I really want to pursue. But that is community governed research funding that operates outside of traditional gatekeepers. Instead of waiting for the institutions to decide what gets funded, the communities actually who want the solutions can pool their resources and fund it themselves. Real similar to crowdfunding. It's really transparent, it's participatory, and it kind of changes who gets to decide what science happens. And we just need to be able to implement that in a growth stage rather than an early science stage, and I believe we can. But that's a long conversation in and of itself. I guess the other things that we can do is there's kind of a direct practitioner and cosmetic use adoption. We talked about that a little bit before. Cosmetic pathway isn't really just a workaround. Every practitioner who incorporates it, every patient who benefits from it, that's actually proof of, I guess, concept building or the momentum of that and generating revenue that then supports all of these continued operations. Probably none of these paths alone will solve everything, but together, more options we've got, the better it is. The question isn't, will someone fund this anymore? The question is, will enough people who want this to exist kind of step up to make it happen? And hopefully that's what we get to explore in the next episode.
Yeah. So just again to set this clear that it's not like you are in early stages of building the product. The product is already commercialized in one way or another in different markets right now. And the whole point is, how do we get into the hands of more Americans or Americans in general? And there are pathways to that. One is definitely the cosmetic route that still exists, but then that's limited by discrete nature of humans, how we discover it.
Yeah.
Yeah.
I want to just clarify. So I don't want to only help Americans.
Sure.
The reason why especially with biotech, there's such a focus and almost all you end up talking about is the US market, because that is the biggest market. And the FDA is kind of the gold standard for, everyone else kind of accepts those types of, if the study was acceptable to the FDA, it'll be acceptable to COFEPRIS and so on and so forth. Hopefully that continues and people don't just change their requirements just because they're mad at the US. But this isn't just for the US. The reason why we would want to go to the US next might not be to sell in the US. It might actually be to accelerate entrance into international markets.
Okay, yeah, that's a good clarification before we conclude today's conversation. I think that's a key point there. So that's good. Well, that's great. Thanks for sharing all the insights again and setting the stage up for, I guess, season 2 here. And with our first episode, in the next one, we'll talk about more details of next subsequent steps that potentially you're planning to take and where everybody can chime in, everybody can help, and that's where it is. For now, I would say that we'll leave the conversation today. This is the recording we are doing just before Thanksgiving. So happy Thanksgiving to all our listeners.
Happy Thanksgiving.
And then, of course, we'll be back with the next episode. Thank you so much.